Uh, it's an honor and privilege to talk in this very important conference. My name is Rajib Shaw, and I'll be talking on the biological hazards, disaster risk reduction, and gender issue. I'm a professor in Keio University in Japan. Along with that, I have several other hats, as you can see in this particular slide. The Sendai framework, which started in 2015 and which goes up to 2030. So it's a 15 years long this framework for disaster risk reduction. The health issue became very, very important in Sendai framework. You can see that the health issue, this particular word has been used 76 times in this 30-page document, which means that it gets a very big priority. And also the scope of hazards. Earlier, we used to talk about only natural hazards, but now in the Sendai framework, it has extended the scope to biological hazards, to cascading hazards, to technological hazards. So the scope of hazards has also increased. So what does it say is the disaster risk reduction and the public health issue. This becomes like very closely interrelated. So that was in 2015 when it happened. Then in 2019, which is last year, WHO published a health emergency and disaster risk management framework, what we call the health EDRM. And that framework actually provides a very good overview of what are the different issues of health-related issues, public health issues, which are linked to the disaster risk reduction. That was on the global level. Then IRDR, that's also last year in 2019, had this health addendum to its resilient city scorecard. And this health addendum is something which is like resilient city. There are 10 different components of the resilient city, how you can make the cities resilient, whether you make the physical infrastructure good, whether you make more community cohesion, whether you make more financing and so on. But then health issue becomes a very critical thing. And there was this health addendum which was made in last year. Then earlier this year, actually, that was in January, with one of my colleague, Emily Chen of Chinese University of Hong Kong and myself, we published this book called Public Health and Disasters, which talks about the health emergency and disaster risk management. And this was, again, the interface between disaster and the health-related issues. And we never imagined, we published this book in January this year, and we never imagined that we will have this particular topic discussed so much over next, like possibly the whole year. But what I would like to point out here also, that when you talk about the biological hazards, it's not only just the point of public health issue. It has a very strong connotation of financial or the fiscal policy. It needs the data management, it needs supply chain management, transport planning, and so on. So it needs a real holistic approach. And that's where this whole disaster risk reduction components come. Recently, we have been working with UNDRR to develop some document which provides the linkage between its biological hazards and disaster risk reduction. You know that there are different types of biological hazards. So this particular slide, it shows these four specific cluster or four specific component. One is the chronic disease, like which are the existing and which are non-emergent, and that exists in many places, that not become an emergency. This on the right-hand side is the existing and emergency. Like after many disasters, we see that there are waterborne diseases, there are vector-borne diseases. Like after flooding, there are lots of waterborne diseases like cholera or malaria, the vector-borne disease. So this and that becomes an emergency. So that's an existing and emergency. There are many new emerging issues, but possibly non-emergency, the new diseases which comes up, and we are always living with different types of disease. But what we are seeing in COVID, this currently, the current pandemic, that this is an emerging, it's a new disease, and it has become a pandemic, which is the emergency. So That's how the strategic risk assessment or rapid risk assessment becomes very, very important for this type of disaster. When you talk about we have been seeing actually in many countries that these biological hazards, so there are many different types of scenario. The biological hazards or the pandemic, this is say for example, scenario A. Now what we have seen is previously that there are natural hazards and which actually led to a biological hazards. As I mentioned, in many parts, like when we have lack of water scarcity, like the drought in Africa, it also gets into different types of public health hazards. So that's the scenario B, which actually enhance a scenario A. Currently, we are having scenario A. But in many parts of the world, including Japan, what we are seeing is currently scenario C, which is we have the pandemic, but now we are having the natural hazards. We have in the southern part of Japan in June, July, we had major flooding. Then also, say for example, in South Asia, in India, Bangladesh, we have seen major typhoon or cyclone hitting in the middle of pandemic. So it becomes a cascading risk. So there are 2 or 3 different types of hazards which are coming together at the same time. And then the problems becomes more complex. So we try to actually look at the learning from the past disaster, which is the learning from past and current emergency. And there, say for example, we looked at all different types of hazards, especially biological hazards, starting from 1918, the Spanish influenza, Spanish flu, then SARS, then swine flu, MERS, Ebola, and Zika virus. And we try to learn several important issues. Say, for example, the knowledge of past handling the past outbreaks, it becomes very, very important. So the past knowledge are possibly for the epidemic, for the new epidemic, the past knowledge is possibly the basis for the new epidemic. Evidence-based decision-making or the science-based decision-making becomes extremely, extremely important. Real-time monitoring, because it becomes a non-linear in nature, so real-time monitoring becomes very, very important. Technology and innovation, we have seen in many countries, many different types of technologies which are applied. So technology and innovations become very, very important for different types of communication. So with the work with IRDR, we try to understand that what are the different sectors which are affected by the current pandemic, which is COVID. There are some primary sector, secondary, then tertiary, quaternary. And we try to understand that there are some positive impact, but there are also negative impacts. Obviously, we start with the negative impact. We have different types of SDGs, Sustainable Development Goal, which has been differentially impacted, whether it is the education, whether it is the poverty, whether it is the safer city, then of course the health and well-being, clean water, sanitation, hunger, the gender issue, this particular conference main theme. I will come back to this gender issue a little bit later, but so there are a huge different types of sectors, and all those sectors are related to SDGs which are affected. But then also there are positive impact. We see some people argue that there have been a drop in pollution, drop in CO2 emission because of the lockdown in many countries. But on the contrary, we have also possibly, there was a very interesting study on Korea actually, that there have been increase in plastic usage. I'm sure that the same thing in Japan, because the people are working from home, so the plastic use, our daily use has become increased. But there are some positive impacts also in this particular COVID-19. I would like to focus on this particular tool which we developed, and this is actually an Elsevier journal in Progress in Disaster Science, which we publish, and I happen to be the chief editor of this journal. And this particular tool, which our team from RICA, Resilience Innovation Knowledge Academy, has developed. So this particular tool is actually talking about two very important aspects. One is the risk communication, and another one is the risk governance. And this is a very simple tool with several component and subcomponent. One is the health issue, of course, the age, comorbidity, gender, smoking habit. Then behavior, people's behavior, whether we are using mask, whether we are hand washing, sanitizing, social distancing, and so on. The exposure, which type of buildings we live in. And that's a major problem in many of the developing countries, that the density is so high, the exposure becomes extremely, extremely high. And then the social policy, that which type of government policies are there, whether there is a lockdown, whether there is a community compliance on this. And based on that, there are different types of risk. So it gives the categorization, whether you are in high risk, moderate risk, or low risk. And based on that, there are very specific suggestions. And then when we have this particular data, that data can actually be used by the local government to understand what the particular risk is, which type of areas have higher risk, which type of areas have lower risk, and so on. So this is a very simplified tool. You can access this particular tool in www.covid19risk.net. And I found this quite interesting and quite feasible. Even you have a very low level of computer literacy or the mobile phone literacy, still you can use this one. This is something what we have done in the compilation of this work with IRDR, that try to look at the Sendai priority. You know that there are 4 specific priority areas and there are 7 specific targets. And what we try to understand that how this biological risk can be integrated, and the integration of the biological risk is relevant. So there are highly relevant, there are relevant and less relevant on different aspects of from priority 1, whether it is the risk assessment or the capacity, the regulation or science-based decision-making, integrated early warning system or the fiscal boosting, and then the BCP for adaptive strategies and impact management versus impact reduction. So that's about the work which we are doing in jointly with IRDR, and try to develop some guidelines for national government. Now I'd like to focus a little bit that how this COVID-19 has affected the SDG. This was a very interesting recent paper by Phil Ho et al. 2020, published in the journal called Sustainability, and it looks on different SDGs and how it is affected. This particular theme of the conference, which is the gender. So here it is like the SDG 5, which is the women are more vulnerable to the impacts of the outbreak with reduced chances of treatment. And that is possibly a major issue in the developing countries, that the healthcare facilities to women are relatively lower than the healthcare facilities in the men, especially in the rural area. Now, let me elaborate a little bit on this one, that, you know, that women have been, there are quite a bit of care work which is done usually by women and the girls. And this is an additional burden of this unpaid care work. And that's possibly linked to some sort of high risk. Then there are some, this is what I'm quoting is mainly from some of the reports of UN Women, especially from the Asia Pacific region, that there has been increase in the domestic violence due to larger tensions in the household and so on. Then the decline in women's empowerment, economic empowerment. Obviously, many women who earlier used to work just only from home, now like the connectivity of there, like say for example in the rural area, there are lots of craft which has been the handicrafts which are done by the local woman, and their connectivity, the supply chain system was very prominent. But now due to lockdown, that supply chain is broken, so that is actually affecting quite a bit the women's economic empowerment. We have seen many cases the exclusion of leadership role of women, and of course interrupted access to sexual and reproductive health. But this is not only just the negative part, but there are some positive aspects. I will come back to the positive aspect a little bit later. But we all know that this our healthcare professional, it is dominated by women, and they are at high risk for infection. So they are actually taking on risk of their life and giving services to the community. And that's how the risk of the woman becomes also quite high. And also, it also due to, it actually puts the pressure on them because without offering the alternatives such as closing of daycare facility for the children, and they are also have some additional stress, like how their children will be taken care of because the daycare facilities are closed, but they need to do possibly extra work in the hospitals and the health center. So that possibly makes it a little bit difficult. But also on the opposite side, it also gives some flexibility of working hours and social norms. I'm talking about the regular female professionals who are working for different types of work. So possibly they can actually have a good balance, work-life balance, working from home. And then also the center, they have, in some cases, they have become center of economic redevelopment. And I have seen some of the very innovative work the local communities, women's leaders have done in some of the urban informal settlements in say, for example, in Bangladesh and like in Dhaka. And these women's leaders, they actually took very strong leadership role. And when women say some word, I think the society listened to it. So I see there are positive role also in some of their leadership, but it is possibly in the informal sector. So we need to promote that. We need to possibly document that, and we need to possibly encourage that to other areas as well. So UNICEF actually recently published some 5 actions to ensure gender equality during this COVID. So of course, the first point is very, very important is the care for the caregivers. Then we know that this gender-based violence is increasing, so we need to have a watch on that one. We need to take proper precaution for that one. There should be proper counseling center for that. Then core health, and this is very important, number 3, that maintain core health and education services and systems. I think the maintaining the basic health and education system is very, very important. And then, of course, the engaging women's and youth rights network. I think the network-based approach is very important. As I mentioned that in Bangladesh, I read some paper and there were some very interesting observations done by this local woman leader in the slum area. But then how you spread that news, how you spread those type of information. So the networks are very, very important. And the final point is the gender data. The disaggregated data, I think, is very important, and we need to properly collect those data, analyze it, and make it actionable. So finally, in the concluding remarks from me would be these 4 or 5 points. One is the health risk management and the disaster risk reduction still, I think, on parallel track with similar goal. We possibly need to have a more coherence or convergence. Global and local framework do exist. As I mentioned, the WHO framework or the IRDR local city framework. But what we need is more at the national level, and that's where this whole pandemic response is all about. And most of the countries are using their health ministry or the pandemic response guideline for this particular pandemic response, not focusing on the disaster risk reduction part of that. There are, of course, a few exceptions in the countries that needs to be looked at. There are scope of integration. There are many different types of scope of integration, starting from risk understanding, assessment, governance, investment, and recovery. As I mentioned earlier, the risk assessment tool, which I showed. I think that's the classic example of this integration. Then the gender implications are very high and need proper disaggregated data, and positive aspects of gender issues also need to be highlighted. So it's not only just the negative aspect, but also the positive aspects of the gender issues. And I think the data becomes very, very important. So with that, I think that's all from my side. Thank you very much for your listening, and thank you for providing me this chance to talk to you. Thank you.